Our demo presentation will be on the tarsal tunnel structures, functions, and risk factors for injury by Group 5, Kayla, Allison, Stephanie, and Robin. So the tarsal tunnel is found in the medial ankle. It is divided by fibrous septae, which join the flexor retinaculum to the calcaneus, and they form 4 separate compartments. There's one compartment for each of the tendons that are included in this tunnel, and also for the bundle, which is contained by the tunnel. So the boundaries are the flexor retinaculum and the medial surfaces of the tibia, talus, and calcaneus, and the contents of the tarsal tunnel include the tibialis posterior tendon, the flexor digitorum longus tendon, posterior tibial neurovascular bundle, which includes the artery, vein, and nerve, and the flexor hallucis longus tendon. The tarsal tunnel can be broken up into anterior and posterior portions. The anterior tarsal tunnel is located anterior to the talotibial and talonavicular joints, which is where the deep fibular nerve and dorsal pedis artery pass beneath the inferior extensor retinaculum of the ankle. However, this photograph depicts the posterior tarsal tunnel, or tibio-talo-calcaneal tunnel, which is posterior to the medial malleolus of the tibia. Here you can see the posterior tibial nerve usually branches into 4 divisions, including the medial plantar, lateral plantar, medial calcaneal, and inferior calcaneal nerves. All of these branches are within the confines of the posterior tarsal tunnel. Additionally, the posterior tibial artery usually branches into the medial plantar, lateral plantar, and medial calcaneal arteries.
The tarsal tunnel function is to protect and maintain structures within the tunnel, including arteries, veins, tendons, and nerves. Specifically, we look at the posterior tarsal tunnel, also known as the PTT. This includes the tibial nerve, which branches into 4 divisions. This includes the medial plantar, lateral plantar, medial calcaneal, and inferior calcaneal nerves. The tarsal tunnel also functions as a space for some of the lower extremity muscles to pass through, including the posterior tibialis and flexor digitorum longus, which inverts the foot and also allows for plantar flexion. And lastly, flexor hallucis longus, which allows for flexion of the large toe and plantar flexion.
Next, we'll talk about some common risk factors for injury, which include direct trauma, such as being kicked in a soccer game, overuse of the foot and or overtraining of the tendon that causes inflammation, swelling, and pain, prolonged standing, walking, exercising, or sudden increase in activity or exercise volume, training overload, performing too high of training intensities and volumes, obesity, diabetes, abnormal foot and ankle mechanics, flat feet, which cause overpronation while running, poorly fitting or worn out shoes, weak ankle muscles, particularly the posterior tibialis or the foot intrinsic muscles that help to support the arch of the foot, and weakness in the hip, pelvic, and or core muscles causing faulty gait mechanics.
Tarsal tunnel syndrome occurs as the posterior tibial nerve is compressed under the flexor retinaculum. Some signs and symptoms may be present, such as dyssynesthesia, which is a burning sensation, tingling, prickling, numbness, and general pain. The location of this tingling, prickling, numbness, or pain happens on the plantar area of the foot. You can see this on the picture on the left. It extends from the calcaneus bone, or the heel, down all the way across to the phalanges, or the toes. It is often mistaken for plantar fasciitis because of the location. However, you can test for it, and we'll show that on the next slide. Some long-term effects of tarsal tunnel syndrome are muscle atrophy, which include weakness and inability to flex the toes, and then there can also be atrophic disturbances, such as decreased sweating. As we've learned in phys rehab, the Tunnel sign is a tool that can be used to help diagnose a nerve entrapment. Although we've only had experience with it so far in carpal tunnel syndrome, it can also be used to see if the person is experiencing tarsal tunnel syndrome. So what you would do first is locate the medial malleolus, so this is the medial malleolus right here, and then you go kind of down below it, and then you tap right on the nerve. And you do this for about a minute, and if the patient starts to experience any tingling or burning or numbness on the underside of their foot, then that is a positive sign. About 60% of patients experience this, and this Tunnel sign works on them. The other 40%, it may need to be diagnosed another way.